I'm going to talk about inflammation and breast cancer. And I think everybody's, we've heard about it now for at least the past 10 years. In fact, every now and then I've seen some Time magazines with the cover about inflammation. It's kind of about 10 or 15 years ago, it became the new thing, the idea that many of our chronic diseases are associated with inflammation, body inflammation. What's so bad about inflammation? Why, has that become, are we talking about it? Because when we think about inflammation, right, we think about sort of that picture on the left, which is the sprained ankle, and it gets swollen and red, and that seems to be part of the healing process. It is part of the healing process. And on the right, you see basically when there's damage, our immune system, inflammation is part of our immune system. Our immune system sends white blood cells out that release all kinds of chemicals in order to help our body heal. And in some ways, inflammation is what you could call collateral damage. So some of the things that our white blood cells do to help us heal are destroy some of our tissue so that the big white blood cells could get in there and help to fight off infection. And in doing that, that's when we get that red swollen area, for instance, around a joint if we sprayed our ankle. But what these last few years about inflammation and chronic disease are talking about is not that inflammation that is directed at a trauma and is needed there to heal, but it's whole body inflammation. It's those chemicals that those white cells release in response to inflammation, running wild in your body, having a lot of those chemicals in your body and causing, and in a sense, irritating your body. When you hear people talk about inflammation, they tend to talk about the immune system at the same time because it is part of your immune system. Because it is your white cells that go out and release these chemicals that cause inflammation. And lately, I've been hearing inflammation and immunity all mixed up together in this time of COVID-19, because it seems like every time I turn on the television, I see some TV show, some morning talk show about, can you supercharge your immunity? And in doing those shows, they often talk about inflammation and immunity almost interchangeably. So how is it that inflammation and immunity are connected? And is it possible, since I wanted to talk about inflammation, but since it kind of crosses over with immunity, is it possible to boost your immunity? Those of you who saw my immunity class at CMH a few weeks ago, this is going to be redundant, but then I'm going to move on just to inflammation there. So can you boost your immune system? Can you boost your immune system, and how might that be associated with inflammation? And could you boost your immune system? Could you eat a diet that was anti-inflammatory, and would that boost your immune system? And could you do that and stay healthier from COVID-19? And the bottom line answer is, if you are unhealthy and engaged in a lot of unhealthy practices, suddenly eating a better anti-inflammatory diet right now is not going to protect you from COVID-19. It's the long-term chronic illnesses that we have that are associated with bad diet and lack of exercise, like being overweight and diabetes and heart disease and high blood pressure, that are the things that are associated in a long chain with diet and lifestyle. And that overweight and diabetes and hypertension are sort of the endpoints of what happens when you have a bad diet and you don't exercise. And those things definitely are associated with more severe COVID-19 illness. But the idea about whether or not you can boost your immune system, that idea is not exactly correct. I know we like to say that, like, can I boost my immune system? But it's really not that you want to boost your immune system. It's really that you want to balance your immune system. And that's where inflammation comes in. So an immune system that's running wild creates some of the worst illnesses we have, like lupus and rheumatoid arthritis. That's an immune system that's not balanced and that is boosted. And you can use diet to treat that somewhat. But the way that we might think about balancing our immune system is about engaging in anti-inflammatory activities. And lots of times, once again, those things are used interchangeable with immune supporting activities. So inflammation is your immune system run wild. It's all those healing cytokines that have no trauma to go to heal, that are just at high levels and irritating our systems. And calming inflammation is what can balance your immune system. So I'm going to talk specifically about the evidence for inflammation in breast cancer, but also the things that you would need to do to calm inflammation are the things that balance your immune system and at least would help you not be suppressing your immune system with bad diet and bad activities, so that you would have, if for instance you came into contact with an infection, you would have a better chance to fight it off. So how do you calm inflammation? Out with the bad and in with the good. So what do I mean with that? Out with the bad. What are the things that suppress your immune system and basically increase your inflammatory markers, the things that cause your inflammatory cytokines to run wild? So smoking cigarettes, drinking excessively of alcohol, not getting enough sleep, having unrelenting stress. We all have stressors sometimes, right? We all have challenges. So it's not that you would have to live this life on a desert island where nothing was ever happening to you. Actually, that might be stressful if nothing was happening. So it's not that we wouldn't have challenge, but that we would have unrelenting challenges. So this era that we're living through right now, in some ways, is an unrelenting challenge. It's a persistent challenge. So even though you may not feel like you're decompensating, even though maybe you're not standing in the corner crying, which I do every now and then, though which might be beneficial sometimes, but even though maybe you don't feel like you are not coping well, I think it might be useful to realize that we're all under a lot of general stress with what's going on right now, and do those things that would help us to decrease our stress. Bad diets, and particularly diets that are high in processed foods, sugar and fats, and particularly processed fats, trans fats, and then animal fats, saturated fats, those are associated with inflammation. And then, there are a lot of social situations that are associated actually with suppressing the immune system and increasing inflammation. And lack of connection is one of them. And we're connecting right now. Bless all of our hearts, right? And I love Zoom for that, even though you can't see everybody else's face, right? Because I got my PowerPoints up right now. But I love Zoom for that, even better than telephone, because just phoning, because you get to see somebody else's face. The other day, I told this story at the CMH class I did, where just by accident, my sister FaceTimed me. And I went, oh, okay, thank goodness I'm not in my pajamas. Good, I'll FaceTime back. And she wandered all around her house with me and told me how they painted their bathroom and showed me her garden. And there was just something so delightful about that. So finding ways to connect right now, those are all important things. Those are things that suppress our immune system: stress, alcohol, cigarettes. And interestingly, some of those things have been directly associated with breast cancer. Excessive intake of alcohol is directly associated with breast cancer. Bad diets are directly associated with breast cancer. So, and maybe it's functioning through inflammation and through our immune system, or maybe there are some other direct effects. So in with the good, what is that? We're here's Dr. Oz. I love to hate him in a sense, because I think sometimes he's just, he's definitely got into marketing and he's selling stuff. And so he's not the balanced scientist that he used to be. But I think he's really got the right of it right here. So instead of saying boost your immune system, he's saying support your immune system. And an anti-inflammatory diet is what we would do for that. And he's got on his table there, he's got many of the things that are in with the good, right? The things that would be anti-inflammatory and supportive to our immune system would be sleep. He's got the little face masks there, and exercise with the little barbells and the yoga mat. Then he's got some supplements. And, if we get time for question and answer, you can ask me about that. But I'll just tell you right now, there are no supplements out there that have been shown specifically to work with COVID-19. I know zinc is out there. I know a lot of the cold herbs against colds like astragalus and echinacea have been touted for maybe helping protect you against COVID-19. There's no studies in any of those, and the studies with them and the common cold are even pretty weak. So same with zinc. Zinc does possibly reduce the severity and might prevent the common cold, but the common cold virus attaches in the nose and throat. And the SARS-CoV-2 virus that causes COVID-19 attaches in the lungs. So there's some ideas that zinc would not be useful there either. Vitamin D is out there. It's people with low levels of vitamin D did in some studies have more severe infections. So, you know, especially the breast cancer survivors, right? You should be getting adequate vitamin D anyway. You can't depend on going out and going for a walk for that. So you may, you know, it might behoove you to take 1,000 to 2,000 IUs of vitamin D. The only other supplement that, there's two things. IV vitamin C was shown in other kinds of causes for ventilation, for respiratory ventilation. In one small study, people got off ventilation faster. IV vitamin C, you'd have to have your doctor in on that, right? There wasn't anything about vitamin C preventing the SARS-CoV-2 infection. Quercetin is another thing out there that's a supplement that is a powerful anti-inflammatory. There was some small studies with SARS-CoV-1 infection, right? The original CoV-1 infection from 2004, showing some benefit, but nothing with what is going on now. So I definitely don't think there's anything in a bottle that you could count on that would protect you. You know, it's definitely hand washing, social distancing, and wear a mask. And one of the things I wish that that the health experts would stop saying is that you're only wearing a mask to protect other people. That is actually not true. Even the cloth masks that we make at home, and there's been some studies with that. Their first studies were done with masks that were made with dish towels, which I thought was an interesting choice, but I guess we do have all of us have those laying around our house. So using a fog machine to act like someone's breath, because we know that the virus is carried on the very tiny particles of your breath. So if you get into an elevator where some, you know, very enclosed space where people that were infected were breathing for a long time, and that fog of their breath with the virus is there, it tends to last in the air for almost 3 hours. So using a fog machine, they found that even those cloth masks that not only do they help prevent you from exhaling possible virus in your breath because you've got it and you don't know, but it was about 84% effective in blocking you from breathing it in. If you take cotton and actually also overlay it chiffon or silk with it, those are electrostatically charged fabrics. That actually increases your its ability to block the virus almost up to 95%. The thing that makes those cloth masks that we're wearing not as effective as an N95 mask is that they do not suction to and adhere really strongly to our face, right? There's that space on the outside of our masks that where we could breathe in. But still 80 to 95% protection from somebody else's breath is terrific, right? That is way better than zero. And if you're both wearing a mask right now, you've got really a good chance to cut down on the transmission. So I wish the experts would stop saying, just wear a mask for other people's sake. I mean, I think that's nice, that's charitable, and I think we should all be charitable in that way, but it also will protect you. So something to think about, not as good as social distancing, right? So even if you both have a mask on, that's social distancing, and being outside, even better. You know, I read this great little thing, which was like, well, if masks work, why do we have to social distance? And if social distance works, why do we have to wear a mask? And the joke back was, well, if seat belts work, then why do we have to watch our speed? If watching our speed works, why do we have to have seat belts? And if they both work, why do we have to have brakes? But it was like, okay, wait a second. Let's have all of it, right? Let's have all of it and be really protected. So nothing in the supplement category that would protect you as well as what your behaviors do. And then on his table there, off to the side there is that basket of greens, right, for diet. And that, of course, that's what I'm going to talk even more about, is about diet. I sent you a handout that was called Eating Well While Staying Home, or something like that. And in that handout, this is a picture of a page from that handout. And, I quick produced that in mid-March, and then over the next month or two, I updated it. But one of the pages in there kind of summarizes what I just said. It says stay connected. In this, it's saying, you can call us at the Cancer Center because we still have services. You can call them at the cancer support communities because they still have services, right? To stay connected with them. Exercise, there's that move your body, nourish yourself with good nutrition. So there's good diet, which I'm going to talk about. Get sunshine and breathe fresh air. That could part of relaxation and de-stressing, right? As well as the bottom, number 6, which is laugh. And we know a lot. I don't know how many of you know Norman Cousins, that really pioneered laughter as a way to boost your immunity and to calm inflammation. And so my advice to you is watch funny movies. Don't watch the news. Stop watching the news. Stop watching the news. Watch funny movies. Watch any stand-up comic that is not too blue for you, because a lot of them seem to be quite blue. But laugh more. And we actually know that you faking it till you make it works, right? That smiling, even if you don't feel like it, actually boosts your immune system and calms inflammation. And then there's that get some sleep. And I wrote in that handout one of my favorite sleep tapes. So if you're having trouble going to sleep, there's one of my favorite tape. You can see how old I am, right? When I first got it, it was a CD, but you can get it as a DVD. You can download it as an MP3, and that's Emmett Miller. And then my older sister just told me recently a great thing, and this is from ACT. This is from a certain type of therapy approach, right? That if you've got a bad thought that's really keeping you awake, set it to a tune, like Happy Birthday, like, I said that thing. Oh, I can't sing. I can't get the tune for Happy Birthday. But if you set to a funny tune like Happy Birthday, that thing that you're worried about, like, oh my gosh, my sister, I said that mean thing to my sister. Does she hate me? If you set it to the tune of Happy Birthday, maybe that helps you get some perspective on the fact that a lot of these things that are keeping us up at night are things that we're imagining. So there's a great page for that. Get in the good, right? So what about inflammation in general? So we talked about sort of what suppresses your immune system, and a lot of the things here that increase inflammation are also things that are directly associated with breast cancer. So overweight and obesity, excessive alcohol, there's that lack of sleep, that being sedentary, and even being sedentary 5 days a week and then getting out on the weekend and over-exercising is associated with inflammation. There's the processed diets. High glycemic diets are diets that would keep your blood sugar up. So that is just a lot of sugar and refined carbohydrates and not a good balance, right? The red meat and saturated fat, allergens and food intolerances. So people who are intolerant to lactose or who are intolerant to gluten. People who are actually intolerant to gluten, actually their immune system is a little bit on higher alert and they have a little bit more of inflammatory markers circulating in their system unless they really get the gluten out of their diet. And then of course, smoking and air pollution and certain kinds of infections increase inflammation, and they're associated with cancer as well. So I'm going to really talk about the diet parts, right? But I don't want you to forget about exercise and lack of sleep and too much alcohol. And especially during this time, I don't know if any of you are drinking more. I'm not, but I can imagine that somebody might be. And then, you know, getting outside, gosh, that's one of the few things we can do, get outside into the fresh air. So do it, right? Even if it's sit out on your patio or get out into the garden, but walk around the block, even better. On the left-hand side of your screen is just those inflammatory cytokines, right? That sometimes you even see on some lab work. One of them that sometimes doctors measure is C-reactive protein, CRP. If you've had a cardiac panel, a heart panel recently, you might see C-reactive protein there. Sometimes heart doctors look at C-reactive protein to help them make a decision about, well, is your cholesterol high enough for me to give you medicine? What's your risk of heart disease? If your C-reactive protein is high, you're at higher risk for heart disease, higher risk for diabetes. So that might push a physician into advising other therapies because you have that other risk factor of that marker for inflammation. So how is that associated? Can we make a connection between one of those markers of inflammation and diet? And we can. This is from the Healthy Eating and Lifestyle study that is women, and that is a study that looked at breast cancer and survivorship. So in this study of thousands of women, looking at scoring their diet according to the Healthy Eating Index. And the Healthy Eating Index is basically the dietary guidelines. It's what you know about eat 5 cups of fruits and vegetables every day and eat less fat and saturated fat. And so the way we all know we're supposed to be eating, right? So they scored those diets and they found that people with lower scores, right, their diets were not as healthy, had higher levels of C-reactive protein. So there we're making a strong connection with women just like us, right, that their diet actually affected a marker of inflammation. So can you affect inflammation? It looks like you can. Interestingly, if people were sedentary and ate poorly, their C-reactive protein markers were even higher. And we might have guessed that, right? Because lack of exercise increases inflammation and bad diet increases inflammation. Interestingly, people who exercised well didn't get as much benefit from the healthy diet because they were getting so much benefit from the exercise. So I don't think that means you can jog down to McDonald's and eat a bacon cheeseburger. I think you should still do everything, right? So markers. So we can associate diet with inflammatory markers. And it's that bad diet that's associated with higher inflammation. Can we associate that with breast cancer? Yes, higher markers C-reactive protein is associated with a greater risk of getting breast cancer in the first place. So people that have higher markers of inflammation have about a 20% greater chance of having breast cancer. But what about if you've already had breast cancer, right? Can we associate those markers of inflammation with survival after already having breast cancer? And in that same study, the HEAL study, where they followed women with early stage breast cancer for 4 to 7 years, what they found was that people that had higher markers of C-reactive protein had lower overall survival. So they had more problems with other illnesses as well as breast cancer. So they had more heart disease and more breast cancer recurring when they had higher markers of C-reactive protein. They had lower overall survival, and that reduced overall survival means they looked at all the causes of death, and then disease-free survival means they looked at breast cancer recurrence, right? Did the breast cancer come back and be the thing that was the big problem, or was it heart disease as well? So we can also look at diet and connect that up with recurrence. So this was not looking at inflammation, but this was looking at diets that would be anti-inflammatory. So in the same study, they found that women that eat 5 servings of fruits and vegetables every day, and that would only actually be 2.5 cups, not the 5 cups that we recommend. So 2.5 cups or more, and were physically active, what was the equivalent of 30 minutes of brisk walking daily, they had a 50% reduction in breast cancer recurrence. So, you know, is the mediator there inflammation? It might have been. And one of the things that I love about this study is that it worked for women who were lean and obese. So, you know, lots of times if you've got a few pounds on you, you read all these studies, you read all these things about breast cancer. If you've had breast cancer and you get depressed looking at all this stuff about, oh, people who are overweight, more breast cancer coming back, you know, what can I do, right? Because I've been on every diet in the world and I've never been able to lose weight. So am I doomed now? Well, in the HEAL study shows that no, you're not actually. That exercise and 2.5 cups of fruits and vegetables every day cut the recurrence in half, and it worked even if you weren't the perfect skinny mini weight. It worked for everybody. Then this is back to what that other study was showing too, which is that specifically it can work for heart disease as well. So this is in women who have had breast cancer. And there's some evidence that women who have had breast cancer have a higher risk of death from heart disease and some other non-cancer causes. We don't know why that is. We don't, because it doesn't necessarily seem to be treatment dependent. It isn't the more treatment you had, you know, the person who had neoadjuvant chemotherapy and surgery and then adjuvant chemotherapy and then radiation, that they have a greater incidence of breast cancer mortality. It just seems there's something, maybe that the underlying things that caused the breast cancer in the first place are also underlying things that cause some other chronic illnesses. But so that women after breast cancer have a slightly higher increased risk of heart disease. And this looks at that anti-inflammatory diet in that HEAL studies also reduce the incidence of heart disease. And you know, most women with early breast cancer do go on to succumb to the thing that gets most women, and it is heart disease. So eating in a way that decreases heart disease is important too. Then interestingly, inflammation in that HEAL study, women that had higher markers of inflammation also had poorer quality of life. So, you know, never mind that those higher markers of inflammation were associated with more chronic illnesses and maybe shorter survival time, but also they had more pain, they had more urinary incontinence, which I think most of us of a certain age experience. They had decreased physical functioning. They rated themselves as not as vital or with as great a sense of well-being, just general lower quality of life. So having those circulating inflammatory markers, and you know, and we've seen other studies just increase your general sense of pain and lack of well-being. So I think I'm connecting all the dots here. I think maybe you're all probably convinced already that you should eat a healthy diet, but just in case you're not, I'm going to take it to the final marker, and that's here in Women's Health Initiative found that women whose diets were rated as inflammatory had lower survival, right? So we've connected all the dots. Are inflammatory markers, blood inflammatory markers associated with breast cancer? They are. They're associated with getting it in the first place and with having it come back and with having other problems like heart disease in women who have had breast cancer already. Can diet affect them? We've shown, yes, in women who have had breast cancer, diet can affect those markers. Eating a better diet can reduce those markers. And reduced C-reactive protein is one of those markers associated with better survival and better quality of life. And then here's that other piece saying, okay, if we just looked at diet, never mind if looking at the blood markers, if we just looked at diet and we rated diet as inflammatory, that's associated with not living as long after a breast cancer diagnosis. So they used this rating called the Dietary Inflammatory Index. So my question is, hey, what is that? You know, what did they use? Because I'd like to look at my diet and rate it. What was the Dietary Inflammatory Index? So here it is. So people who rated higher on the Dietary Inflammatory Index. So basically what that would be is that would be people who are have more inflammatory diets, are not eating an anti-inflammatory diet. So they ate less vegetables, in particular less leafy green vegetables. They ate less low-fat dairy products, more high-fat dairy products. They ate less fish, which is in general an anti-inflammatory flesh food, unlike even chicken and poultry are inflammatory. I'm not saying that you can't eat them, but you should get a balance. They ate less fruit, less nuts, less whole grain, and less beans. They ate more of those things that we know are bad things, right? They ate more salty snacks, more separated fats, margarine. Not that margarine was worse than butter necessarily, because high fat dairy was a problem. So lots of fat, basically, more sweets, more diet beverages. So I don't think you should be drinking regular Coke because of this, because high sugar diets were also a problem. I think we should be drinking water, lightly sweetened iced tea, that kind of thing. Refined grains, so white bread, white noodles, nitrate processed meats, so that's the bologna, hot dog kind of stuff, more French fries. So, interestingly, the French fries are pulled out as an actual food category because that's how much French fries people eat. So less of the good stuff, more of the bad stuff, just what you might think it would be, that caused them to have their diets rated as inflammatory. So to get a diet rated as anti-inflammatory, more of the good stuff, less of the bad stuff. So that just is intuitive, right? And I think most of us, and if you've been in any of my classes, of course, I pound away at these things. And I'm going to show you some things you've got, handouts that I sent you there that are going to say this too. I sent you these slides, actually, not every single slide I have here, but I sent you these in a slide that was attached to Veronica's invitation to you as well. So people always ask me, okay, well, what are the absolute most anti-inflammatory things I could eat? And really, all anti-inflammatory, I'm going to search around here I'm going to look and make sure I sent this to you in a slide. I think you've got this in the slides I sent you. But so everything in the plant kingdom has anti-inflammatory properties. If I'm pushed to what's the most anti-inflammatory? Okay, berries and cherries, fatty fish like salmon. The oil on fish is anti-inflammatory. It's more like the oil in nuts and seeds. Cabbage family vegetables, so that's broccoli, Brussels sprouts, cauliflower, kale, radishes, turnips even. So cabbage family vegetables, and cabbage family vegetables have been shown in some studies to have a direct anti-breast cancer effect because they actually boost up the liver detox systems that metabolize estrogen and help lose it from your body. So especially where estrogen receptor positive breast cancer is concerned, cabbage family vegetables are a good thing to eat. See if you can get them in every day. Arugula in your salad, or radishes as a garnish kind of thing, or raw cauliflower for a snack. Garlic and onions. One time I had a client come to me and say, I don't like garlic and onions. Can you make me a menu with recipes? And I said, I can't because just about every recipe I make starts with chop up some garlic and onions, throw it in the pan with some olive oil. So garlic and onions, highly anti-inflammatory. The peppers, so the bell peppers, red, green, yellow, chili peppers, all anti-inflammatory. Mushrooms are highly anti-inflammatory. Grapes, we could see grapes kind of up there in the berries and cherries category. The extra virgin olive oil. So the extra virgin olive oil, really, the extra virgin part comes from really its taste and how much polyphenols it has in it. The polyphenols are the things that are anti-inflammatory. Dark cocoa, and I'm going to show you a study about that in a minute. And tomatoes are anti-inflammatory as well. And then there's our favorite old dark green leafies that show up on everything. So think about, are you eating that? Are you eating fish twice a week? Because that would be one thing that you could do. Are you taking advantage? The cherries at Vaughn's right now, I know they're not organic, but you can afford them because if you've got a Vaughn's card, they don't cost you an arm and a leg like at Whole Foods. This is cherry season, and the cherries are terrific. If you don't have a Vaughn's card, it's $15 for a bag of cherries, and that's what it is at Whole Foods. But if you've got a Vaughn's card, it can be $6 for a bag of cherries. So think about, are you eating these things in your diet? Then the other things that are highly anti-inflammatory is almost all the herbs and spices we use. We have lost touch with the fact that that these things are not just flavoring agents, that they are almost all highly anti-inflammatory as well. So think about that when you're cooking. Some of the things that we would count as dietary supplements are anti-inflammatory too. There's vitamin C. There's fish oil, which you can take in a pill. There's alpha lipoic acid, which is a natural anti-inflammatory that we make, and even stinging nettle, which I usually use as an herb for people that have asthma and breathing problems. Boswellia serratia is another thing that you often get as a supplement. So I'm not encouraging you to take these things as supplements. I'm encouraging you to eat the things that have this in them. It's really easy to get a good amount of vitamin C. Fish oil, you could eat fatty fish twice a week. Tart cherry concentrate, eat those cherries. You know, you don't have to. Tart cherry concentrate, if you've got gout, tart cherry concentrate will help you reduce the pain of gout because it's so highly anti-inflammatory. If you really just feel like, okay, my diet's not the best and it's hard for me to get out and get the best diet, is there any kind of supplement that would do it? Here are some supplements that are combination supplements that have a lot of the herbs and some of the nutrients that we call anti-inflammatory in them. My favorite is that new chapter 1, Zyflamine, and it is a combination of a lot of those things you see on the right of your screen. If you smell it, it smells like an Indian meal and an Italian meal all combined into one. It has been studied to lower PSA levels because it's anti-inflammatory, so the marker of prostate cancer. It has one small study with arthritis, because it's anti-inflammatory. So if you just really felt like, I need to take a supplement, I don't trust my diet, then that's one you could take. Prothera Inflathera is another one. And then up in the top left-hand corner is Integrative Therapeutics Pro Thrivers Wellness Flavonoid Complex. So it does not have a lot of those things that are on the right. It has some other flavonoids. But that is a supplement that has been formulated by Lise Altschuler, who is a very well-known naturopathic doctor, cancer doctor. And so it might be interesting if you wanted to Google that and look at it. But you can get online, you can get all of those online, but New Chapter you can get online, you can get in Lassen's, you can get in Whole Foods. And what you would do is take 2 a day. Now, I'm not telling you that if you take that, you're not going to have cancer coming back, or you're not going to have COVID-19 or nothing like that. But if you have arthritis pain, you may find that it helps you, but it's not the kind of thing you would take it like an aspirin and suddenly you would be out of pain. It's the kind of thing where you would take 2 a day for 3 months and suddenly you would realize, oh, I'm not taking my Advil anymore. Or I'm taking 1 dose of Advil in the morning, and then that second dose that, you know, usually I'm biting everybody's head off at 3 because my arthritis is bothering me so bad, and that reminds me to take my other Advil or whatever it is you're taking. You may find with taking that Zyflamine that you can take less, and actually there's many studies that have shown that with anti-inflammatory supplements that you might take less of the Advil or your Voltaren or whatever else you might be taking. So in case you're interested in supplements, those are the only ones that I would recommend. And then here's finally some good news about chocolate, right? This was a study that just came out that found that chocolate consumption was associated with lower risk of coronary artery disease. So, right, plugging up your arteries, it gives you a heart attack. And that idea has been out there for a while. Sorry, I got up and turned the fan on in my office here. That idea has been out there for a while, but this was a systematic review where they picked out the best quality studies, and really there were only 5, and found that chocolate consumption was associated with less heart disease. Here is the downside. 1 serving a week is all that was needed. It isn't a chocolate candy bar every day. And in fact, the reason why I've got that picture of chocolate and cocoa is that you get all the positive effects from cocoa. And a lot of the chocolate candy bars, right, have sugar and added fat in them. So I would advise you to get your chocolate from cocoa. and not from candy bars with all the fat and sugar in them. And in that eating well while staying home booklet I sent you as an attachment, or Veronica sent you for me as an attachment for this, there is a terrific cocoa-based smoothie that is vegan. If you're vegan, or you've got any vegans in your family, right? That is got the protein source is walnuts and almonds and flaxseed, and all of those are highly anti-inflammatory food products because the oil on them is like the oil on fish. It's an anti-inflammatory oil. And then there's those frozen dark sweet cherries, as we just saw on our top 10 anti-inflammatory list. There's ground cinnamon, which is very anti-inflammatory as well, and that tablespoon of unsweetened cocoa powder. And then you can use water in this, or you could use, I like to use unsweetened vanilla almond milk, and because it makes it taste sweet. The cocoa with the cinnamon, notice that there's no sugar in there, but the cocoa with the cinnamon, even if you use water, makes it seem sweet. It's that cherry chocolate cinnamon thing, makes it seem sweet. But if you use the unsweetened vanilla, soy milk, or almond milk, then you get something that tastes even sweeter. I think it tastes dessert-like. Now you might think, why is she saying soy milk to us? Doesn't she know we've had breast cancer? Well, if you've ever been to any of my classes or been to see me, that you know that actually there's no evidence for soy increasing your risk of recurrence of breast cancer. And in fact, there are several big population studies that show that populations who eat more soy have less recurrence. So I don't think a population-based study is strong enough that you should go out and take soy products in capsule form. But I don't think you should be afraid of soy products. When I first became a cancer dietitian, women were not even eating soy sauce because they were so worried about the soy in it. So I don't think if you used soy milk, or if you ate a Boca burger, or if you ate edamame, the fresh soybeans when you were if we ever go back out to a sushi restaurant again, that you would eat that, I don't think you need to be worried about that. Or if you used it in this, soy milk does have protein in it and almond milk does not. So that's another thing. If you were gonna make this for somebody else, maybe who was losing weight because of their situation, then and not able to eat right, maybe you would wanna use soy milk for the protein in it. So if I get a chance, I'll make that smoothie for you, but you've got that recipe in your handouts. So all those lists of foods and herbs, and how do you put that all together into what you eat every day? This is how, right here. Just look at your plate. Is half your plate fresh fruits and vegetables? Is a quarter of your plate whole grains, and a quarter of your plate a good clean protein, and maybe fish more often, which is anti-inflammatory, and beans more often, which is anti-inflammatory, and nuts more often in your salad or in your rice, which is anti-inflammatory? That's how you would see whether or not you're eating an anti-inflammatory diet. And in that handout that has the recipe in it for the cherry chocolate smoothie, in the middle of that handout, I think page 9 or 10, there's a picture of that plate with some text, with me typing in about what I'm talking about, on the meat protein, a quarter of your plate should be the meat protein. Choose, lean poultry and meats, and choose fish more often, and have meatless days sometimes too. And then as a companion to this, I like that plate graphic because I really like, okay, look down at your plate. Are you doing it? If you look down at your plate and it's a whole pile of white spaghetti noodles, you're not doing it, right? And then, how can I fix that? Right? Okay, well, I need to chop off a couple of that spaghetti, get it pushed up into a quarter of my plate. No fair Mongolian barbecue where you've got a mountain of noodles. It's got to fit on that corner of your plate. And then if you're looking at that for dinner and you're crying because that's not going to fill you up, well, you got to get the salad on the other half of your plate, and you've got to get the lean protein on the other quarter of your plate. Either that it's turkey meatballs or meatless meatballs, or, I make a bolognese sauce with actually chickpeas with garbanzo beans. So you could use beans or white beans as your protein with spaghetti and red sauce, right? And a big salad on the other side. As a companion to this there is another handout right after that plate graphic page. And this is a heart healthy diet. So this diet graphic is from some studies called the Omni Heart Studies, where they looked at, okay, is a low carbohydrate diet the thing you should eat? Is a low fat diet the thing you should eat? What's the diet that you should eat? And what they found was it was a kind of a combination of the two, that this was a diet that was associated with the lowest risk of heart disease. It's also associated with low markers of inflammation, with low C-reactive protein, because they're measuring that when they look at these studies of heart disease. And because of that, it's anti-inflammatory. It would be immune balancing too. So there's that 5 cups of fruits and vegetables. Notice the whole grains, only 4 servings. That is different than the typical USDA plate. It's 6 to 11. So and I think this is the right thing for breast cancer too. I think that low glycemic diet is where you're not having an entire plate of spaghetti, and just because it's whole grain and it doesn't have that much fat, all you want. I think it's a little bit more limited than that. So 4 servings, then 2 servings of dairy. And right now the evidence does not really point to dairy being a problem for breast cancer. I would prefer that you do 2. I would prefer that it be non-fat actually, because the growth factors are often in the fat. And I actually would prefer that it not be fluid milk, that it would be yogurt, plain yogurt, and a piece of good natural cheese. Then beans and nuts every day. And only 1 serving of poultry or fish, only 1 serving from the meat category a day, right? Instead of meat, animal protein, lunch and dinner, animal protein once, and your other protein would be beans or nuts. 2 teaspoons of oil. Well, that's really down there. I'm sorry, 2 tablespoons of oil. That's really down there for the typical American diet. And then just 2 teaspoons of sugar. The typical American eats 22 to 24 teaspoons of sugar a day, added sugar. The American Heart Association says for women 6. This is even a little bit lower than that. And then there's that plate graphic down there again. So if you wanted a little bit stronger look at a little bit more strict how much of what, there it is. And that is associated, not been studied for breast cancer, but for heart disease and for lower markers of C-reactive protein as well. In that same handout, after this pages, I've given you a lot of recipes. Now, I wrote that handout when I thought we were going to all be at home eating canned soup. Turns out that didn't happen exactly, right? We figured out how to go to the grocery store. We figured out how to order from Bonds. But I put a lot of handouts and a lot of recipes in there for that kind of thing. And in a lot of ways, that's a great way to cook, right? So it's not those recipes that take you all day long to make them. That, there's a lot of dump recipes. That 5-can vegan chili, right, is onions and garlic and green pepper, and then a can of kidney beans, a can of corn, what my mom calls dump soups, right? And that has cashews in it. And then just a lot of other ideas of like, did you end up with 2, did you rush out and buy 3 jars of peanut butter because you thought you weren't going to get out again? What can you do if you've got peanut butter? What can you do with that would be healthy? And did you grab a can of salmon because all the tuna was cleaned off the shelf? Well, there's a recipe for salmon, some quick recipes for some things that are in there. And then there is a recipe there is a page on canned soup. And I found this great handout when I was looking at all this on like how to make canned soup taste amazing. And one of them was, more herbs. Use herbs, right? And if you to boost them up. So you've opened up a can of just vegetable soup. How could you boost it up? So I planted an herb garden. I've had herb gardens before, but I didn't have one right now. So I planted an herb garden. So I'm going to. So there's cilantro, right? And it is what's called bolting. It's bolting. It's flowering, right? And it's growing these up big, tall. Here are the leaves that are actually tasty that you would use. One of the bad things about cilantro is that when you cut it, it doesn't regrow. So you have to plant it. You have to, I get little Dixie cups and plant seeds and then plant them in a rotating way. So here's some little ones that are coming up here so that
this is really not usable. This bolted cilantro here is not usable. The flowers are pretty, and I often use the flowers of herbs to garnish things. In the olden days, when I used to have people over for dinner, I hope you can see it. There is the basil that I have. Same kind of thing. These basil flowers don't have a very good flavor like the leaves do, but they're beautiful garnish. Here's a thing I planted lately, and I hate to even cut it down because it's so beautiful. This is dill. This is Italian parsley, and these beautiful garnish, right? These basil flowers. This is Thai basil, which has more of a licorice taste and is fun to put in other things. I don't know if you can see, but here is rosemary. Now, this was supposed to be Tuscan blue, but that is not Tuscan blue rosemary. That's a big, thick stalk, and that's a big, fleshy leaves. Still gives the rosemary flavor, but it's not as easy to throw it in with your roasted vegetables, the whole stalk in with your roasted vegetables. You have to take the leaves off. And then here's spearmint. That's what I'm going to use in the smoothie that I'm going to make. This is oregano, and this is 2 different types of oregano. Beautiful flowers once again. This is Greek oregano and Italian oregano. And one of the things about most of these herbs is that you can make tea with them. And in fact, in the areas of the world where people live routinely to be over 100, more people live to be over 100, they often go out in their garden and just grab oregano and thyme and make tea out of it. Here's thyme, which is a beautiful plant, right? And making some flowers too. I trimmed this off and used this. I used the thyme and the oregano recently to roast vegetables. This is another mint that is peppermint, right? Which is anti-nausea and makes a great tea. This is chives. So I'm going to pinch off some of these spearmint right now because I'm going to use that to make my smoothie. And it will grow. You probably can't see, but there's little stems are starting. So even though I pinched that off, it will regrow. I got a little station set up here for me to be able to wash that mint because I just picked it off my plant and I'm about to make something out of it. So I don't want, the cats have probably rubbed by it. Catnip is a mint, right? Not that cats like this kind of mint, but catnip's a mint. So I'm gonna just wash these leaves so I can make it. It's a 1/4 cup, that's what I thought. And this is a common recipe for me to make in hot weather. I just love this. The mint makes it just so refreshing. So it's a 1/4 cup of mint. So I've just got some here and I'm just washing it because I just picked it, right? And I'm gonna stuff it into this 1/4 cup. And I do think you can overpower this recipe. So we're gonna use our mint as an anti-inflammatory, and we're gonna use spinach as an anti-inflammatory too. So I'm just gonna take a handful of spinach, it says a packed cup, and put it in my, if you were here eating, I would use gloves, I just want you to know. But since you're not, I can use my hands. So I'm gonna put that on my blender here, and I've got 2 cups of cold water here that I'm gonna put in it. Now I've got this big blender that I could throw over the kitchen sink in it and would blend it up. But if you're using a regular blender, then you really want to do this where you put the water and the spinach and the green leaf in now and blend it until it's smooth. So let me see, I see some of you making, how are you doing? I don't want to get ahead of you. Do you guys have your greens in there? I can't hear them. I see somebody saying yes. Okay, so plug your ears because I'm gonna turn on my blender here and let it go until it's smooth. Okay, how does yours look? Does it look all smooth? If you don't get it really smooth, you're gonna have green things in your teeth, but that might be okay. It might be like a badge of honor. This is how much vegetable I'm eating. I've got green things in my teeth. So pretty simple, right? Mint and spinach, and then 9 ounces of pineapple. Most of the bags of frozen pineapple are 16 ounces, so I'm gonna
I'm going to make a guess at it. Now, pineapple has bromelain in it, which is, you know, we often think of bromelain as a meat tenderizer, but it's very anti-inflammatory as well. Okay, so do you guys have your pineapple in? I'll wait and see people catching up. Oh, you do? Okay, good. All right, I'm going to turn on my blender again, so watch your ear. Okay, that's it, basically. Now, if you wanted this to be colder, just depending, you might have put some more ice in it. I like this when it's really, really cold. So this makes 2 servings. And I just made this for, oh, I'm making a mess here. I just made this for a brunch recently. And where's my, I guess I used all my mint. Oh no, here's my other mint. And of course, if we put a little sprig of mint in it, then it's quite lovely, right? And makes for a good, a brunch dish. So